My name is Nicandro. I'm a spinal neurosurgeon and I work here in King's College Hospital London in Dubai. I had the pleasure of assessing 𝐊𝐢𝐜𝐚, one young gentleman, 14 years old, who came to me with a history of back pain for about a year or so and spinal deformity. And his deformity was progressing significantly since last year. There are different kinds of deformity. 𝐊𝐢𝐜𝐚, he had a spinal deformity called Sherman kyphosis, which is the severe deformity of the spine. We can see on this slide, showing that the angle of his deformity was around 82 degrees. He's considered surgical for his age, above 70 or 75 degrees, and his case was still progressing. So after full assessment of 𝐊𝐢𝐚, we conclude that he really needs surgery to fix his deformity, to correct it. Most of the time, those patients with this kind of spinal deformity can be treated conservatively with physiotherapy, brace, and we can stop the progression of most of those cases. However, in the case of 𝐊𝐚, his deformity was already too much to be treated conservatively, and he was treating outside since last year and with no result. After a good review of his case, we prepared the treatment plan, which consists of 6 steps. First, the spinal approach from the back part. We release the spine, which is called osteotomy, in several places to give more mobility for the spine to facilitate the correction of it. And then we implanted the screws, more than 20 screws on the spine, in order to fix the spine properly. And then we proceed with the correction of the deformity. We remove part of the bone to put some bone graft on the top of, and we close the skin. The whole process took around 8 hours or so under general anesthesia. We're using also intraoperative neuromonitoring and some new equipment which really help for the precision of the surgery. One of those is called OR with neuronavigation, which gives us, as we can see, a 3D image showing all the details of each implant on the spine to minimize the chance of any misplacement of the screws, because his spine is already deformed, so the anatomy is not preserved. So all those equipment really helps to minimize the risks of the surgery, which is a complex surgery. During the whole procedure, the surgery went very smoothly. The patient was stable. We could check all the implants in a good position, and we could achieve a very good correction of his deformity as planned. After surgery, 𝐊𝐚 had a very good recovery for this kind of complex surgery. He started to walk with the assistance of our physiotherapy team, and he went home after 6 to 7 days. He's walking, he's in full recovery at this moment.
My name is Sean. I am 14 years old and I study in 𝐍𝐢𝐜𝐚 Founder School. My doctor's name is Dr. Nicandro, and we had gone to him around 2 months back for my back, which is bent around 80 degrees according to him. So nurse Nobin helped me a lot. He made me feel like I was more connected to the staff, and he really helped me connect to everything, and I learned how to walk then properly without any sort of dizziness or balance loss. I walked for a bit, and after that I did my X-ray. It was really painful, but it felt really good to finally get that out of my system and start moving around. Then as time went on, the pain became slightly easier to manage. I would like to thank Dr. Nicandro and the surgery team for doing a good surgery on me. I would like to thank the nurse Nobin and Binsi, who really helped me recover.
My son's name is Sean Serrao. I'm his guardian mom. My name is Diana. So I think around 2 to 3 years back, he had been continuously complaining that even though he's running around or he's exercising or he does anything, he has lower back and upper back pain. So that was creating a lot of issue for him in terms of, studying or having any activity done around. We got him to Dr. Nicandro after a couple of suggestions from other doctors. We got him to the hospital, and when Dr. Nicandro saw him, he said that he's having an ailment known as Schumann's kyphosis. It was a shock for us because we used to think that it's something to do with the posture. At King's, it was a very pleasant experience. I'll say the staff is amazing. Both the nurses, the physiotherapists. There were times when my son would refuse to even keep his feet down to the ground because it would hurt. But it was their constant coaxing, their encouragement, and the nurses, a shout out to them, really. A lot of patience. I know it's very difficult to deal with a teenager, and they were really hands-on all the time. I'm really very happy with them.